The national rollout of the vaccination program 26th February. First of 3 phases will go to frontliners, followed by the elderly and those registered with chronic conditions. Regardless of population size, statistics have shown that Asian countries have handled the pandemic comparatively better than places like Europe and North America. Nowhere more so in the residential care setting. Long into the global lockdown, the big news story to emerge was the overwhelming yet underreported death toll, coupled with gross mismanagement in assisted care facilities in places like Ireland, Italy, and the US. Further worrying for Western countries now is the reluctance amongst medical staff to be vaccinated. In France alone, 76% of senior care home staff said they didn't want to get vaccinated, according to a poll in December 2020. In a 2003 speech following the SARS outbreak, the Malaysian Minister of Health at the time said, Malaysia acted swiftly and expeditiously in instituting barrier nursing and enhanced hospital infection control measures in all clinics and hospitals. The experience of SARS in 2003 and the measures followed to prevent outbreaks in residential care setting has shown to be effective during this current COVID-19 outbreak. Currently, there has been no report of local COVID-19 outbreaks in Malaysian long-term care facilities. Nevertheless, the Malaysian Society of Geriatric Medicine published interim recommendations to reduce risk of outbreaks by suspending group activities, restricting visitors, frequent hand hygiene, temperature checks, designating isolation area for suspected COVID-19 cases, and special handling for residents' admissions and transfers. Even before the emergence of COVID-19, those elderly that do not reside in assisted care facilities like Vida Senior Care have already faced significant barriers in accessing health services and support, such as transportation difficulties, higher medical costs, fear of discovering serious illness, and lack of doctors' responsiveness to concerns. The Movement Control Order (MCO) has been used to keep residents indoors, raising concerns that diagnosis and treatment delays could negatively impact the vulnerable. At Vida Senior Care, those concerns are taken care of. Whilst in the care of trained medical staff, the residents naturally build their own community of social and emotional support. They receive 24-hour medical monitoring and specialist care for their individual conditions. Whilst observing strict SOPs specific to resident care settings, family members may still visit and enrich their condition. At Vida, we know how difficult it can be looking after your loved ones. We take pride in finding the right kind of care in our staff. And you should too. That is why our doctors are always at hand to support the team that supports you and your family. Caring is just a simple call or message away at Vida Senior Care.